County. These are exceptional times requiring exceptional leadership, and your support during the last few months have allowed Warren County to weather this storm and prepare for any future dark days that lie ahead. Together we have accomplished much and tackled the task at hand. To quote Churchill, "We shall draw from the heart of suffering itself the means of inspiration and survival." Today on our BLTV live stream, we have Governor Bill Lee, and we also have our Department of Health Commissioner, Dr. PIERCEY. So welcome, Governor Lee.
Thank you, Mayor. Glad to be back on your show, talking to all the folks down there in Warren County.
So I know these are difficult times for sure, and I didn't know if you wanted to give some words of encouragement, what's coming next, anything that Mike could do locally, maybe discuss the educational special session that's coming up in the General Assembly, and how we're going to put people back to work, because I know you've got a new initiative, Jobs for Tennessee.
Yes, sir. It's these are certainly unusual times, and yes, they are difficult. We are dealing with some tremendous challenges, but they're incredibly. There's some incredibly good things happening at the same time. I like to think of it as being a redemptive time, but in order for things to be to come good out of challenges, you have to have challenges, and we are certainly having those. And your region has not been spared that. COVID is. We had a tremendous surge 2 or 3 weeks ago. We made some adjustments. We asked Tennesseans to really be thoughtful about how they do their holidays, and that's what happened. They were thoughtful about it, and as a result, we're 2 or 3 weeks away from Christmas, and we have not seen that really terrible surge on top of a surge that could have come, that many states are seeing right now. So we're hopeful, cautiously optimistic. We still have very, very big challenges. Hospitalizations are still very high. Our COVID numbers are high, but we are continuing to move forward. One of the things we're hopeful about is the vaccination. Of course, we built a very strong infrastructure here in this state. CDC said we had the best plan in the country. We're currently delivering at about the third highest rate in the country, our vaccines into Tennesseans. We're getting them to the most vulnerable, the nursing homes, the elderly population. And we will, in just a few short weeks, begin to see the effects of that on our hospitalizations. Because if you vaccinate the elderly, then you get at those that are most likely to get seriously ill from the vaccine. The limiting factor for us, and it's been frustrating for a lot of folks, is the amount of vaccine that we're getting. It's very limited. We're getting it into people's arms as soon as we get it, but we are at the mercy of the distributors to us. We are encouraged that the federal government is ramping that up, so we are seeing more and more vaccine coming headed our way. But I would just tell the folks, if you weren't able to get your shot this week because of lack of supply, don't be too discouraged. We are working to change that so Tennesseans, especially those 70 and 75 and older, can get the vaccine. We're making certain that our nursing home residents get it. But be encouraged. Be patient with us. We're doing the best we can, and we're actually doing better than most any state in the country. But it's slow, but very, very hopeful.
So one of our big things, of course, is trying to get our kids back in school and education stabilized. On my show today, I've also got our Director of Schools, Grant Swallows, who'll be giving us some updates from the school system. So what are you expecting to come out of the educational special session?
Yeah, another thing I've been really pleased about, you talk about kids in school, and one of the things I've been pleased with is our determination to do everything we can to have kids in person in school. Starting from the very beginning, our strategy to give supplies to every classroom so teachers would be safe, students would be safe. Our commitment to educating our kids in person where possible in spite of and alongside a pandemic, has been our commitment to that's been strong. Commissioner Schwinn is a strong believer in keeping our kids in school. So we've worked hard to get that done. At the same time, none of our kids were in school in March and April and May. A lot of children in the state were virtual even through the fall. And sometimes it occurred because of quarantines and whatnot. So what we had is this serious learning loss. And we are deeply challenged. We've had challenges in this state prior to the pandemic, particularly in the areas of reading and early education, early grades, literacy. So I saw that as a crisis, educational crisis, as a result of this pandemic, and subsequently decided to call a special session. And the difference for those kind of wondering why a special session instead of just letting the legislature deal with it, the regular session would last until probably April, maybe even into May, and whatever laws are enacted during that session would go in effect then, that would become law at the end of the session, and then, of course, would take some time to get into effect. If you call a special, then next week, when the special session occurs, those laws that are in that part of the session will be finalized next week, and then they can begin to be implemented. So for education, that means literacy bills, that literacy plans that will become law next week, we can start to implement them in the spring and summer. If we have support for teachers or for support for students like tutors and or a summer school strategy, then those can be implemented this year instead of waiting until next year. So really important special session, very important topic. Have to do it swift and have to do it certain so our kids and our teachers are taken care of through this process.
So moving forward, what do you think our biggest challenge is coming up in the next month or two?
I think it's this idea of managing the what is but is not yet. So we know that we are coming to a much better place in COVID. And that means that we've got work to do. We've got economies to thrive. We have schools to open, and we have a lot of work to do going forward as a state to return our state to what I believe will even be a better place than it was before. But at the same time, we still got 3,000 people in the hospital. We have a death rate that we're losing scores, we're losing tens of 60, 70 people a day to this virus. We have not blunted the surge to the capacity or to the extent that we need to. So we're in the midst of this pandemic and the ill effects of it, and they're particularly severe at the moment. But at the same time, there is, we're vaccinating. Our curve is just flattened out. Our schools are opening back up. Our economy has some tremendously encouraging numbers. When we look at the most recent unemployment and revenue numbers, so our economy is performing very well in this state. That's not true in every state, but it is in Tennessee because we've kept our businesses open for the most part. So the challenge is holding both of those things at the same time. It's kind of been the challenge through the pandemic, lives and livelihoods. How do you protect lives in a health crisis and protect livelihoods, keep a state open, keep the economy going, keep businesses open, keep your lives moving forward? We got another month of that. We got another month or two of carrying both forward. It's very hopeful. I'm very cautiously optimistic, and I'm excited actually about where we're headed as a state as we round this corner of COVID.
Well, I know you've rolled out the Jobs for Tennessee. Do you want to just give a little preview of that a little bit and explain what that is to our listeners today? And then I'm hoping I'm on a conference call with Commissioner McCord this week, and maybe I can get him on my show next week to talk a little bit more about Jobs for Tennessee.
Yeah, and I'll just get a little teaser. I know you got Dr. PIERCEY on the call you want to talk to as well, but because Jeff McCord can really give a full description of what that is. But the idea is that we got 250,000 jobs in this state, and we have a lot of folks that have been unemployed. They're coming off the unemployment ranks, and we want to connect jobs with people. And so we have a plan to do that. We have a great opportunity in Tennessee to up the ante on meaningful employment and on getting people into even better jobs than they had before this pandemic. It's kind of the whole redemptive belief that I have, that I believe the way God works in redemption, taking the hardest of things and actually turning them to good if we will pursue it. So there's more to talk about that, and Commissioner McCord can give you a full layout on it, and I would invite you to have him on the show because we need folks to understand just how much opportunity there is out in this state.
Well, I know you're on a limited time schedule. Is there any parting words of encouragement that you want to share with our listeners today?
Well, I'll close on that redemptive, encouraging piece. I do think there are really good days coming for our state, and there are things that we know now that we didn't know before. There are things that we see now that we couldn't see before, and those are all good signs for where we're headed. At the same time, I encourage Tennesseans. The reason we're not in a post-Christmas surge is because people paid attention when it got tough. They haven't gathered. They haven't had a bunch of folks at their home. They didn't do big parties over the holidays. They're distancing, they're masking, they're washing, they're doing the stuff they need to do, and we just need them to do it for another month or two, and I think we're going to be in a much better place. So be encouraged. There's good days ahead.
And thank you for your service, sir, and you take care and you be safe, and we look forward to working with you in this upcoming year.
Thank you, Mayor. See you soon.
We've also got on our live stream today, we've got Commissioner Dr. Lisa PIERCEY from the Tennessee Department of Health. So welcome, Dr. PIERCEY, and I know you've had your life full of challenges over the last few months, and now with the rollout of the vaccines and testing continuing and a lot of unknowns and moving targets out there, would you like to give an update just on where we stand as a state as far as some of our numbers, our testing, and our vaccine distribution?
Sure, happy to. Thank you for having me, Executive Haley. I'm glad to join you again and happy to provide you with a brief update. So let me start with just state of the virus. We are seeing what we believe might be a hint of plateauing. Our cases are still rising, our positivity rates are still pretty high, but we've seen steady numbers over the last 5 to 7 days. That's not long enough to declare victory or to signal that we're starting to go down the hill, but we are encouraged by this. Particularly, we are encouraged that our hospitalization number has been flat for about, well, I should say flat or a little bit declining over the last 5 or 6 days. We're not exactly sure why that has happened yet, making sure that there's nothing else going on that we're not accounting for, but I think it's probably a reflection of what the governor just got through saying. It was sort of a wake-up call to everybody right around Christmas, and I think everybody internalized the narrative of, if we behave at Christmas like we did over Thanksgiving, we're going to have family and friends die. And fortunately, we have not seen that big post-holiday surge yet. Not out of the woods. It's going to take 2 or 3 weeks before we can finally say we missed it, but we are encouraged with what we have seen so far. Testing continues. As you know, we shifted around some testing and vaccine priorities in our local health departments, where we are doing in-person testing on Tuesdays and Thursdays, and then self-testing on Monday, Wednesday, Friday. We've been doing that for, I suppose 2 or 3 weeks now statewide. Was bumpy for the first couple of days when we got through that transition, but otherwise our testing numbers have remained steady. Some people really like the self-test, and so that's going well for us. The most important part of testing is that if you think you might be sick, whether you think it's a cold or allergies or whatever, with the high prevalence of COVID right now, it is very likely COVID. And so even if you have mild symptoms, you need to get tested. So I just want to remind folks that even though really the exciting news and what everybody's talking about is the vaccine, let's not forget that the virus is still raging. One other point on that is this variant or mutant strain that has been identified. There's one from the United Kingdom. There's one from South Africa. There might even be a third one out there, a third or fourth one out there. You know, I wouldn't have you be too alarmed about that, because this is what viruses do. Viruses mutate. They are pesky little creatures that if they start hitting a roadblock, because people aren't as susceptible anymore, they will mutate and find a new strain or grow a new component in order to infect more people. That's just what viruses do. So for people who have not yet been infected, and there are still the vast majority of Tennesseans have not been infected, they are highly susceptible to this new strain. It spreads very quickly. The good news is that it doesn't appear to be any more severe than the strain that we've been seeing here, but it does have a significantly higher increased transmissibility, which is a big fancy way of saying it spreads like wildfire, and so you have to be extra careful. The good news is that the vaccine does appear to protect against the variants that we have identified so far, but let's not forget those very important blocking and tackling strategies of wearing your mask, washing your hands, and watching your distance. I know people get tired of hearing all of that, but it's really effective. One kind of fun fact that we were just discussing this morning, because people are doing those things, just those basic actions, that's why we are essentially not having a flu season so far. And flu season typically peaks in January and February, and we really haven't seen an uptick at all in flu cases this year. Everybody, a lot of people got flu shots, which was a good thing, but these things like wearing a mask and watching your distance and avoiding crowded places, those work for flu and other viruses as well. So that's encouraging to us. When we talk about what our primary approach is in the state, and the governor mentioned it as well, we think all about risk. And we categorize risk into 3 big categories, and we try to focus all of our efforts around this risk and reducing it in this priority order. Number 1 is risk to our healthcare system, making sure that our hospitals and emergency rooms and EMS still stay healthy and on the job. Because if you can't get the highest level of care when you need it, all of the rest of the healthcare system doesn't matter. The example I often use, if you are in a really bad car wreck and your leg is amputated, a walk-in clinic is not going to be able to help you. You have to have that top level of highest acuity care. And so our number one risk bucket is that healthcare system and making sure it stays protected. Number 2 is the individual health outcomes. That's basically protecting the most vulnerable. In our state and in most states, that is the elderly population. In Tennessee alone, and it's the same across the country, but specifically to Tennessee data, more than half of our hospitalizations and 80% of our deaths are in the 65-plus category. That means we need to protect those individuals. And then the third bucket of risk is to our society and economy. Those things that really keep our economy and our society going, and protecting those who are at high risk of exposure with that. So those are the priorities that we've used when we've talked about how to roll out vaccine. I suspect that you are well aware that we have a strong focus on the 75-plus category right now. We've already finished most of our healthcare workers. Some of our large metro areas are still working through those large workforce numbers. But by and large, We've gotten through most of the healthcare workforce and are really focusing on the 75-plus population right now. I anticipate that very soon we will move that down to 70 or even 65 because of that, exactly what I was just telling you. Those are the people most at risk for both hospitalization and death. And if we can prevent them from going to the hospital, that helps protect our healthcare system as well by reducing the demand on that. So a couple of final comments on vaccine, and then happy to answer any questions that you might have, Executive Haley. We are currently in the 75-plus category in most, in most counties. There are a few counties that have been vaccinating the 1B population, which is K-12 workforce. Most of them are focusing on the 75, but I think it's important that you do a few things if you think you might be eligible for the vaccine. We have an online eligibility tool which will tell you, you put in your risk factors, you put in your age and where you work, and as far as type of industry that you work in, and it will tell you which phase you're in. And then you can quickly click on your county map, and it tells you which phase your county is currently vaccinating. And if you are in phase, as of yesterday, all of the counties now have an online sign-up. We realize that the phone systems have been completely overwhelmed, and many systems, unfortunately, have crashed just because of the demand of calls. So we expect that this online system will greatly reduce the number of calls that are coming into the health department and give people a much more convenient way of signing up for vaccination. Bottom line, the demand greatly exceeds the supply right now. But the good news is that the supply of vaccine is expected to start ramping up by the end of this month and then go throughout February and into March. So we're really looking forward to moving through those phases quickly and getting our most vulnerable protected. So I'll stop there and happy to answer any questions you might have.
Okay, and thank you for that. I've got it on my county executive's webpage, also those links for online signups. You know, we've got, I think, 1,000 people now on a waiting list here in Warren County. And so a lot of folks, particularly the elderly, that a couple of weeks ago I helped at the health department on Saturday directing traffic, and nothing broke my heart more than having to turn a long line of probably well over 100 cars because we didn't have enough vaccines. So a lot of elderly, particularly those who got that first dose, are extremely worried if there's going to be a second dose available for them. And what do they do if it's 21 days and 28 days, then 30 days, and they still haven't been called in to get that second dose? So a lot of elderly people are worried. So if you could address that just a little bit, and what can I say or do to help calm those fears?
Sure, that's a great question. We are starting to see the very first people that were vaccinated in mid-December are now due for their second shot. And a big wave of people will become eligible next week. The good news is there is I don't really want to call it a separate process because the process is relatively the same, but you are prioritized differently if you are awaiting your second dose versus your first, because we all recognize how important that second dose is. One important thing to remember is that it doesn't have to be given on exactly that 21st or 28th day. And people oftentimes ask me, well, how much grace period do you have? Like, is it a week or is it 10 days or a month? We don't know that answer right now, but what we do know is that you have 90% protection after that first shot. So after 28 days after that first shot. So you are protected. The second shot really helps lengthen that duration of protection. So if you have to wait 28, 30, 40 days between shots, that's not going to affect the first dose. But I do want to reassure you that our health departments are prioritizing those second dose folks to make sure they get their second dose in.
I know a lot of rural communities, and Warren County was blessed because we got some of the first vaccines in. You know, a lot of rural communities are thinking maybe the urban centers are getting greater access or have more doses available just because of the population thing, but it still doesn't stop I guess people overreacting a little bit, because in the Upper Cumberland, we've had this huge surge. It scared a lot of people. They expected the doses to be here sooner. And it really warmed my heart to think about some of those 75-year-olds that were in line a week or so ago. And many of them remembered the days when there were no antibiotics, there was no polio vaccine. And so they saw the devastation that those diseases had prior to having vaccines. And they were all willing to roll up their sleeve and take that shot, and because they knew the results if they didn't. So I was pleased, and it was a good testimony listening to some of those 90-plus-year-old people talk about those days where there were no vaccines. So, but thank you for your service. I didn't know if you wanted to leave any parting words, or what's next, where we're going, and what we can do in Warren County to help you in your cause.
Thank you again for having me, Executive Haley. I guess my parting words would just be a plea for grace and patience. We recognize that everybody wants the vaccine right now. I want to reassure you that our plan, Tennessee's plan, has been praised by both Vice President Pence and CDC Director Redfield as the most equitable plan in the entire 64 jurisdictions of all the states and territories. If we have a huge focus on equity, that is between urban and rural and minority and those not in the minority, of old and young. And so the issue here is our demand greatly exceeds our supply, and we are getting shots out as quickly as possible, and we will continue to do that. And as the governor mentioned, we anticipate in the coming weeks we're really going to see some positive benefit for that. So appreciate your patience, and thank you for wanting the vaccine because it is the key milestone in changing this pandemic. Thank you again.
Thank you again for your service. So I want to thank Governor Lee and Commissioner PIERCEY for joining us today to give us some really good updates on where we're going and some words of encouragement to all of Warren County and our listeners today. I'll give you another quote from Churchill. He's one of my favorites anyway, who said once, "One ought never to turn one's back on a threatened danger. If you do that, you will double the danger. But if you meet it promptly, without flinching, you will reduce the danger by half." So I want to welcome two members of my team here today to get some updates. So we have Dale Humphreys, the CEO of River Park Hospital, and then we have Director of Schools Grant Swallows.
Thank you very much, Executive Haley. Good morning, Warren County. We are encouraged that vaccines are here. We have better treatments, but we do expect somewhat of a surge. So let me run quickly through some numbers and just update you exactly where we're at. As a state, obviously, we've got 657,000 cases and 7,800 deaths. COVID-19 has killed patients in every age group, including 4 patients under the age of 10, 4 patients under the age of 20, 42 patients under the age of 30, 79 patients under the age of 40, 255 patients under the age of 50, and 663 patients under the age of 60. And those numbers increase, as you heard earlier, into the higher age groups and higher percentage of mortality. But I believe looking at those numbers and realizing that this affects everyone creates a little bit of urgency on us continuing to follow these rules and get past this next phase as we roll out vaccinations. We've done over 5.8 million tests, and our state's positivity rate is a little over 16%. The number of hospitalizations in Tennessee is down slightly from its peak of 3,344 patients, which was on January 6th. We're down to just over 3,079 cases currently hospitalized. The number of patients in the ICU is also down slightly from our highest point, which was on January 5th, of 798 patients. We're currently at 741 COVID-positive patients in our state's ICUs. Our concern is that only 10% of the state's ICU beds are available. They're at 90% capacity. Only 14% of the state's floor beds are available. And the post-Christmas surge should start to peak. Another issue is not only do we worry about the capacity, the space, the location, the empty bed, but the staff to take care of those patients. So moving on to Warren County, we stand at 4,813 cases. We've had 51 deaths. Warren County has had 32,000 tests performed, and our positivity rate remains higher than the state average at 25%. So 1 in every 4 people being tested are positive. Our highest one-day total of new cases was 3 weeks after Thanksgiving. That was December 17th, where we had 144 new cases reported. If that time frame holds true for the Christmas holiday, our peak will be later this week on January 15th. At St. Thomas River Park Hospital, over the last 7 days, we have averaged 18 COVID-19 positive patients hospitalized per day. And we've had an average of 6 ICU patients that were COVID positive every day. Today, however, those numbers have increased slightly. We are at 21 COVID positive patients hospitalized, and 7 of those are in our ICU. Thankfully, we continue to offer bamlanivimab, which is the monoclonal antibody infusions to outpatients within 3 days of their testing positive. That helps the body's immune system clear the virus much sooner. These treatments have prevented many potential hospitalizations. River Park has given 187 of these infusions, more than any other St. Thomas facility. Local physicians have been provided instructions about how to order these infusions for their patients. River Park has also vaccinated well over 100 of our associates and physicians with the Moderna vaccine, and as we receive more shipments, we will work to vaccinate high-risk patients in the community in coordination with the health department. Thankfully, Dr. PIERCEY did mention that the vaccines are effective, against the new strains of the virus. So please wear your mask, social distance, wash your hands, and get vaccinated when possible. We are so close to getting beyond this pandemic, but I continue to see and hear and read about families who've lost loved ones due to Thanksgiving and Christmas gatherings, and it's heartbreaking because these people did not have to die. Please take care of yourselves. May God bless you, and God bless Warren County. Now we'll hear from Grant Swallows. Thank you.
Thank you, Mr. Dunlap. I do just want to say I appreciate all his work and the work of our medical professionals, particularly at River Park Hospital and at our health department. That staff is doing great work trying to get vaccinations, and want to just publicly say we appreciate their work. Warren County School System is currently in a period of remote learning. We did make that decision coming out of the Christmas holiday, much because of the reasons that Mr. Dunlap laid out, that we anticipated after Thanksgiving a post-Thanksgiving surge that has also been predicted after the Christmas holiday, and we felt like as a school system that we wanted to give our employees and our students an opportunity to stay away from each other, stay at home, learn from home during this pivotal time in our community. It is not the ideal setting for us in the school system and for our children, but at the end of the day, it is the right decision, and it's a decision that we felt had to be made in order to protect our employees and our students. I will say that over the last week, we have seen a lot of great work going on. I will tell you that students that are in grades K through 5 have been provided with paper packets of information and learning. We asked families to come pick that up at school. That information is also available online through Google Classroom and a number of different avenues that your school could have communicated with you. Students in grades 6 through 12 are actually learning online each day through Zoom. They are being asked to log on and be in class at the normal class schedule time, and teachers are logging on and teaching through that. So there's a number of great things going on. Even in a remote setting, we are still trying to provide a great education for our students, even in a difficult time. Furthermore, we are also seeking to provide for our students in all the ways that we normally do, through school lunches, We are still delivering school lunches through our bus routes, are taking food and going to bus stops and delivering food. Families can also go by your school between 11 and 1 and pick up meals for students. The student does not have to be present. The families can go by and pick up those meals and take those home if they are able to. We want to be able to provide that for our students even during a time of remote learning. We are also offering help for schoolwork. Our normal tutoring hours are after school. Those tutors are available via remote learning or Zoom. Those links should be provided by your school. We also have our teleteacher program, which that information is on our website, warrenschools.com. If your child at night at home gets home and is trying to work on their schoolwork and has a question that you cannot answer, we do have teachers at each school available in grade bands and each grade or in each different subject. If you need that assistance, you can go to our website and get the phone number to call, and you will be directed to a teacher, and your child can get help through that. There are also a number of resources available. PBS continues to put out great material that is intended to help children learn remotely or virtually or however they are learning at that point. So I will say, I do want to address that we are hopeful that we will go back in person next week, that the plan all along has been to learn remotely through the 15th and try to go back to in-person learning on Tuesday. That's after the Martin Luther King holiday. I will say that I'm not announcing that officially simply because of what Dale talked about. We are going to wait and see what the cases in our community do over the course of the next couple of days. We are hopeful. We are trending in the right way over the last few days by numbers going down, but we have to be cautiously optimistic that we will all choose to do the right thing, continue to distance, continue to do everything we can to mitigate the spread of this virus. It is our hope, and I've said this from this podium many, many times over the course of the last 7 months, to have our students in school. That's where we want them to be. That's where we know that they can be successful. But at the end of the day, we are going to make the best decisions to make sure that we keep everybody safe, because we can't learn if we're not healthy and we're not safe. So I'm asking you, I know that there's frustration out there. Many people have reached out to me, and I appreciate that. I know there's frustration everywhere, but we continue to work to try to get our students back in the schools where they belong. So one last thing that I want to add to this is that the work of education still continues. One important deadline that's coming up is for students that are seniors that are filling out the FAFSA, which is Federal Student Aid. And it's important that they understand, students, that deadline, in order to be eligible for Tennessee Promise, you must fill out the FAFSA by February the 1st. That was actually extended, and so you need to take advantage of that. Our folks are able to help you, are willing and able. If you need help, you can call 668-5858 and ask for Leah Simpson or Jennifer Cantrell, and those two ladies are phenomenal at what they do. They would be happy to help you. So I'm asking you to, students especially, or families that are listening to this, if you have students that are eligible for federal student aid in the coming year that need to fill out the FAFSA, please reach out to Warren County High School, specifically Leah Simpson or Jennifer Cantrell, and they will be able to help you. Appreciate your time today. Just want to add my encouragement and thanks for all that's going on in our county, and very much looking forward to what's going to happen in our community over the course of the next few weeks, and all that will go on for the good of our students and citizens in Warren County. Thank you.
Once again, I want to thank Mr. Swallows and Mr. Humphrey for a job well done. Your service across this community is appreciated. It's been a team effort from day one, and I think everyone in our county knows that. The worst may not be over, as we know, Everyone still must do their part. That's been reiterated over and over and over for the last few months, and we will continue to do so until this virus is contained and mitigated and is behind us. With 50-plus deaths in Warren County now, there's probably not too many people out there that have not been touched by a loss in your family or by a friend. I know it has touched me, and those deaths weigh heavy on my heart as we move forward as a community. We're still asking everyone, just do your part. It's a simple process. It doesn't have to be political. It doesn't have to be aimed at any individual. It just needs to wear the mask, social distance, avoid those gatherings that become social spreaders, good personal hygiene, respect the health of others. As Dr. PIERCEY said, just those simple things that we've been doing over the last few months has kept the flu season down. And so looking, toward the future, that may be something that we start doing during the winter months to avoid flu seasons in the future. If we're going to get our kids back in school, if we're going to keep the economy going, if we're going to keep essential services out there, everyone must do their part. The safety and security of every resident of Warren County is important. If we're going to prevent deaths and unnecessary hospitalizations due to carelessness or reckless behavior, we have got to do our part. We have to support the systems. Those of you that have been touched by this know exactly what we're talking about. The vaccines are here, and as Dr. PIERCEY alluded, the rollout and the distribution has been a little complicated. We're still doing testing. The vaccines are here. She said grace and patience. Grace and patience. Have to wait your turn. That's what Americans have always been taught to do. The governor's state of emergencies, of course, and his executive orders are still in place. Mine are as well. And so if we all do our part and follow what is necessary, we will all be better off as a community. As you know, most federal and state offices are still closed, no access to the public. So please, once again, be patient with those offices as well. My office gets phone calls every day about Social Security office, unemployment offices, everything. And, I can't get anyone to answer. Please be patient, go online, call those offices, leave messages, do what you got to do. The county, of course, has been struggling to keep doors open, and every day is almost a moving target. With people being sick and with offices being shut down, we're trying to keep our doors open and essential services there. And so far, we've done the best we can. And a shout out to all of my employees, all of the people in Warren County that have had patience standing in line or understanding that sometimes offices have to be closed to protect employees. With no employees, we don't have services. The courthouse is usually under the Chief Justice and the AOC and the Attorney General's on its operations. So I know some court dates have been rescheduled. Some things like grand jury has been put off until March. Please be patient with those as well. Just call the offices. Call the offices. Sanitation working their butts off to get the garbage picked up and solid waste delivered to Southern Central for disposal. So please be patient, even in those long lines as well. Our employees are doing the best we can. There are a few announcements. There'll be a home grant from the Tennessee Housing Development Agency being announced here soon, so that information will be coming. So those of you that live maybe in possibly low-income situations, have substandard housing, there'll be some funds available coming up that you may have access to and can apply for upgrades to raise your standards of living. Our bike grant is being closed out. Some of you may have seen some of the stations around town where you can pump up tires or fix a wheel on your bicycle, and some new lanes along the highways that basically enhances the use of bicycling across the community. We also got a transportation grant, so we have deviated routes through the UCHRA that many people are using, so it's our single source of public transportation, that with U-Carts, but you'll be seeing some covered bus stops at key locations around town to accommodate those folks that are using that. There is a CDBG grant that we're going to be applying for as well. And so I've been asked to read this notice for a community survey for Northern Warren County. It says Warren County is working with the Upper Cumberland Development District to apply for a 2021 Community Development Block Grant through the state of Tennessee. The proposed project is to purchase new fire apparatus which will improve fire protection in the area served by the North Warren Volunteer Fire Department. As a part of this application process, and this is important, the community is required to complete a target area survey related to household information. In January and February 2021, the Upper Cumberland Development staff will be conducting these surveys of residents who live in North Warren County. Surveys will be conducted by phone. Callers will be requested to supply some household information, including some income levels estimates. No Social Security, no personal information will be required or asked of you. No other financial information will be as well. It's just to identify low-income areas that may qualify for additional support to our volunteer fire departments. All information received will remain confidential and is usually only used to determine the eligibility of a community for this grant. If there's any questions about the validity of a caller or any information that's been asked of you, just call my office at 473-2505. We're also going to be reaching out to county commissioners in those districts to actually help with this survey and to explain to the residents the purpose of these questions by phone. It's to help us qualify and to protect, once again, the safety and security of everyone in the North Warren area. I do want to give a shout out to all our support agencies. There's great need out there in the community. The feeding programs continue. Housing has become an issue. The number of homeless people has risen over the course of the last few months. The $600 stimulus check did help. There may be more coming. We're not sure what is going to come out of Washington next with the change of administrations. We're hopeful that additional monies, CARES Act, stimulus money will be aimed, particularly at rural communities that have suffered from some of this pandemic and economic downturn. Most of our numbers still remain relatively good as far as sales tax and business, but we still have a growing number of people in need. Let's also, once again, look at, as a community, all those things that are required of you. It's taken a long time for us to accomplish over the last few years. So another quote from Churchill said, "To build may have to be slow and laborious task of years. To destroy can be the thoughtless act of a single day." I think some of us have seen that over the last week or so. As Americans, we are strong. We have faced trials and tribulations when the future looked even more bleak. These do not have to be our darkest days. In the past, we have rallied, we have united, we have sacrificed, and we have endured as Americans. Why? Because we are still the greatest nation in the world. We have set the perimeters for democracy and have expanded the hopes of freedom to people all around the world by being an example to everyone that we honor and cherish democracy and freedoms more than any other nation in the world. And even though we may be suffering through some of the worst of times, we're also going to be celebrating the triumphs of the best of times that are coming. We've done it in the past. It was a simple formula. And once again, we will rally to the challenge that's ahead. Churchill once again said, "All the great things are simple, and they may be expressed in single words: freedom, justice, honor, duty, mercy, and hope." This leads me to some recent challenges that we too will overcome. As a government and as an economics teacher for 40 plus years, let me read to you the First Amendment that I taught in my government class. That's from our Constitution. It says, "Congress shall make no law representing the establishment of religion or prohibiting the free exercise thereof, or abridging the freedom of speech or of the press, or the right to peacefully assemble and to petition for a redress of grievances." Yes, without a doubt, the First Amendment rights are paramount to all the things that we do, that what defines us as Americans. No person should ever feel deprived of any of those freedoms or those precious rights that we have earned over the course of our history. No government should suppress those freedoms. Civil liberties and equal protection under the law are part of our Bill of Rights, and all personal freedoms remain the basis of American constitutional law. However, events that lead to intentional death and destruction of both private and public property are another matter. Lawlessness and disorder have never been protected under any portion of the Constitution, our Bill of Rights, or First Amendment. Insurrection against government and violence toward law enforcement are not free speech. As an elected official, I take an oath to uphold the Constitution and the laws of this land, which I have always done. Never, and I repeat, never, would I endorse or support any infringement upon any citizen's right to exercise free speech or any First Amendment rights and privileges. However, I will be quick to condemn violence and attacks on law enforcement that are there to defend all Americans from foreign or domestic assault. Let me remind you that when we take the solemn pledge to a flag that represents freedom and democracy and is symbolic of who we are as a nation and has been for years and generations, that we are one nation under God, indivisible, with liberty and justice for all. Together, we are Warren strong. Thank you.